Welcome back from afternoon tea. Those of you who I have not met or who you don't know, I'm Ross Womersley and I'm the CEO of the South Australian Council of Social Service, and I'm really pleased to be here this afternoon. I think unfortunately I haven't been able to be here all day, but I'm assured that it's been a very useful, thought-provoking conversation. And my job this afternoon really is to try and take you and our panel on a journey that leaves us with some sense of what the way ahead is. And from my understanding, some of the discussion that we've had in the room today has, while it's been very thoughtful and helpful, it's also sometimes been quite high level. And there's this real question about, well, how do you convert that back to our context, where we are today and what's happening in our patch? And so we're very fortunate to be joined by a very knowledgeable group of people, a very experienced group of people who are going to help start this conversation. But I'd also invite you, I know that Slido's been new, it's kind of been the new toy in the room, and some of you have obviously become very proficient at it, congratulations. And some of you have kind of found it a little bit more challenging. But here is an opportunity for you to continue to use Slido as a way of you getting some of the things that you want to hear on the table. And I will try my best to monitor what's coming up through the questions process, and we will see how we go. So those of you who haven't taken the opportunity to vote in the poll, I'd invite you to vote. I'm not sure, Meg, whether we can get that easily up on the screen so everybody can see. You probably can, I'm not sure. So, this was really a question about how well do we listen to the people that we serve? How well are they at the centre of our work? And in every sense, Olive's presentation just before you went to break was much about creating circumstances where she too was looking to be able to listen to the people that they were looking to serve and to build a service response that acknowledged and recognised and built those people into the system. So that's enough from me. I'm going to go to some of my esteemed panel members now. Now, all of you got a program this morning? So you can see in your program what the backgrounds of all of the people. So I'm not going to spend a lot of time actually giving you their backgrounds, but I am going to start with Alice, if that's okay, Alice, just because you're on my left and that seems reasonable. Many of you will know that Alice is the ED of Shelter SA, who are, one of the standing advocates on behalf of people who are homeless across the state, and of course are part of a national network of shelters spread across the nation. Sadly, the funding for National Shelter was one of the areas of funding that was removed by the federal government last year, and there's no funding that supports National Shelter per se, but the network of shelters exists across the country. And so Alice, you get first chance to tell us a little bit about, how you've seen today, and then to be thinking about what that means for the way ahead.
Thank you, Ross, and thanks for having me here today. I'll just also let you know that Shelter SA is the peak body for housing, and through our work, advocacy and policy work in housing, of course, we are concerned about homelessness, which is on the rise. So I really like this panel, and a lot of the conversations I've had during the breaks have said, all right, but we want action. What are the actions? It's great to hear these ideas and listen to these wonderful people, but what are the actions? Well, I really enjoyed Roseanne's talk today, and the reason is that it's very affirming for us here in South Australia on a policy and systems level, because it shows us a way forward. And what Shelter SA have been doing recently is actually working on her name-only list. The thing is, we haven't been calling it that. We know this methodology as Registry Week, and it's called by different names in different countries and in different states in South Australia. So what we currently have in South Australia is a rough sleeper street count that our department undertakes about twice a year to try and gauge how many rough sleepers we have in the inner city of Adelaide. So that has some limitations as a methodology, but I think what the sector has told us is that it's better than no data. You know, we need to know something about the people who are rough sleeping and how many of them there are and where they are. So the benefits I see of the by name list, I can elaborate on, if you like, a bit more where Roseanne left off. The reason we like them so much at Shelter SA is because it's a real advocacy tool. We don't just know how many people there are. We don't just establish their vulnerability with a scale that's uniformly applied. We can draw in the business community, the private sector, other demographics, business people, so that we can provide the housing that rough sleepers need. I think it's old-fashioned to solely look to government to solve our problems around the supply of social and affordable housing. So this is a fantastic campaigning and advocacy tool. And by bringing in various sections of the community, it makes it stronger. It places that ownership firmly in the community. And today's the perfect day to start acting on something like that in South Australia, because here we have all the peak bodies. We have SACOSS, as Ross said, the Mental Health Coalition, Shelter SA, as well as the service providers, the workers, government, SAPOL, and various other providers. So I'm encouraged by what Roseanne had to say.
Thank you, Alice. That's a nice little opening statement. Geoff Harris, you're the Executive Director of the Mental Health Coalition of South Australia. Now, your speaker information is a bit further back, I think, in the profile. Did you speak twice? No?
Yes.
Just once? Sorry. Geoff has been at the Mental Health Coalition for how many years now?
Too many. That's 10. That's what I'll admit to.
You need to move the mic towards you. So anybody who, in fact, has been connected to mental health in South Australia probably has run into Geoff along the way. He is a tireless advocate for the interests of people who have who are living with mental health issues, and I think brings to this conversation both a level of wisdom but also a whole lot of experience that should help guide us in a really positive direction. So, Geoff, tell us a little bit about your reaction to things today and what you think the way ahead looks like.
Okay, that's a big question because we heard a lot of things today, and I've already talked a lot, so I'll keep it short. One of the things that leapt out at me was Mike Slade's, I think it was an objective he's got about the workforce, which is to have 50% of the workforce with lived experience. What a change that would be. I think one of the statements that was made was about aspirations of previous governments in different jurisdictions around people leaving health services into homelessness, and the flip side, people in health services who could be discharged sort of medically or clinically speaking, but don't have either the housing or the support to go to. Gives us, I guess, markers for targets that we can have, which brings me to the outcomes issue of, we talked a lot about the kinds of things we want to see in the system, but we've probably not traditionally done well at collecting data that's meaningful around sort of the consumer experience of care and the contributing life, the aspects of contributing life. So we do need to do really simple things like how many people in our services arrive with poor housing or homeless, and what happens when we discharge them, like what's their housing status. Those kind of things we can look at different areas of people leading good lives, and we can collect data and report it a bit better than what we have, I think. And the other thing that struck me about the national review that David Butt did with the National Mental Health Commission was just that thing of looking across other areas where people with mental illness turn up and looking to get better outcomes. And one that springs to mind is around the justice correction system, and really, having a strong focus on that. Say, okay, we want to make this better, and sort of starting at the point. And I hope I'm not stealing people's thunder. But the point at which people come to the attention of police, right through to if there's incarceration and after and post. And so just really trying to be strategic and targeted and look at what we're doing to try and make a better fist of supporting people to get back onto leading good lives. And that's all I had that leapt out at me strongly today. Yeah.
And we should come back, you should talk a little bit about the lived experience, the work that you've done in the coalition to ensure that peer educators are ensconced in the system. So let's come back to that maybe. Sitting next to Geoff is Paul Dickson, who is, I should know, Assistant Commissioner in the South Australian Police Force, and he too has had an extensive career. I think he's been in the force for 16 years or so now. Is that telling stories out of it?
Well, I wish we could say 16, but I joined at 16. And I'm now 55, so it's a little bit longer than that.
Yeah,
But I'll take
young.
16, that's good.
So you've got a wealth of experience up your sleeve, Paul, and I'm sure that over time you've watched the police force emerge and change, and I'm sure that in all sorts of ways, one of the things that we rely on our police service to do is we call on them at the times where we have no one else to call on. And they're often the point at which they confront the pointy end of the problems that we have in the community. Paul, what do you think the way ahead is? And given what you've heard this morning, are there reflections that you think, lessons for us?
Thanks, Ross. The word complexity, in our presentations today has come up on a number of occasions, and I think we should really reflect on that, because we are living in a very complex world when we are dealing with homelessness. And really, just for the agency of SAPOL, even within ourselves, we have a whole lot of balancing acts that we have to do in dealing with homeless people. We've got the appropriate service provision we need to provide to homelessness, either as a victim or as an offender. And then we've got the general community needs and the fear, which is obviously more of a fear of crime and a perception of crime than a reality of crime. So we've got to balance all these things together and provide a service to everyone in a fair and equitable way. So that's our complexity. But when you look at the whole question and all the different agencies that are involved, the question becomes far more complex. And I really think if I was asked the question, what will make the difference? I think we can make a difference as a collective, but the challenge that we have is to have that true dedication and commitment of all agencies to the vision that we have. Now, often as we all know, we might have a vision, but because we come from a particular agency, we may have a different road to get to that vision. That'll always be the case because we've all got capacity levels, budgetary levels, all those sorts of issues which bind us. But taking that aside, if we could get a commitment from this very intellectual group that we have here today, that we have a true commitment from whatever agency you come from, that when you form that partnership as a collective, that you are truly committed to the outcome that you are involved in seeking. Because we often find that some agencies, and I don't intend embarrassing anyone today, is that they are involved in the committee or the group, and we often find that after the first 2 or 3 meetings, we start with one person, then we have a rotation of different people that come to all the next meetings. I can see a number of people nodding now. I would argue if that is the case, don't get on there at all, because you just become burdensome. What I would prefer is to have people who are truly committed to the fundamentals of whatever that committee or that steering committee is, because that's the only way we'll make a change. We all want a change here today, but we need to have that true commitment. So I suppose the message I'm pointing out, let's have that true commitment, work together as a collective, because I do think we will and we can make change. Just on one other thing which was brought up just a little while ago from the panel, was I actually do believe that the case management aspect, so if you're asking of a action that we can actually do, and we do it to a degree, case managing homeless people is a great way to actually, where we can look at all of the agencies involved, what can they do to assist this individual and work as a collective and to move forward. I really think that is a true action which we can achieve, and we can do it probably better than we have done it in the past. So thank you, Ross.
Thank you, Paul. There's a couple of things to come back to there, not the least of which is how we build the... it's one thing to argue that we should have continuity in who helps to structure these discussions on an ongoing basis. It's another thing to ensure that people have authority and what we do know, and I think you described it, that in a sense that issue of we start with the senior personnel with authority and then we end up with the people who have the least authority in organisations sometimes sitting around the table, and that means that decisions can't be progressed and issues can't be progressed. I'm sure, Bill, that's not an unfamiliar issue for you across time. You're the manager of the Central Adelaide and Hills Partners in Recovery program. You must do a bit of work trying to get people in the room together to agree ways forward. Tell us a little bit about your reaction to some of the stuff you've heard today, but also I'm interested in that question about how we build that coalition and collaboration.
Thanks, Ross. Yeah, I guess for myself, I've taken two key themes out of today, and the first one is the notion of hope. And you know, the day's been inspiring for me, and it fills me with a sense of hope that change is possible, that people in this room, people in panels, our speakers, we want to and we can see a way forward. That way forward isn't going to be smooth, and I think we need to keep the sense of hope in context of some significant major reforms that are all happening at the same time. You know, we've got the NDIS, we've got the PHNs who are, 3 weeks old, they're not established at all. Locally, we've got Transforming Health, amongst others, that are happening at a state and at a national level. And I think in holding that hope, you just need to be careful and cautious that we don't point the finger as to one of those reforms being the panacea for all. Those reforms and all the others that are part of this package, I think we need to treat them all and look at them all as being part of a bigger system. They're all puzzles, and they would all work together as they mature as we move forward. So maintaining that hope of change, I guess, is a critical one that I've taken out. The other one is exactly what you've just pointed to, Ross. Collaboration can happen and does happen. From a Partners in Recovery perspective, over the last three and a bit years, we've been able to see a collective impact model work across a variety of sectors. We've been heartened when we see and work with a person with severe and persistent mental illness and complex needs, the willingness of services to come to the table. Once we get past the cautiousness and the we've been burned syndrome, as I've defined it in PIR, and that is translated into a reluctance to then get involved, because historically, I think it's fair to say, when Service X comes on board, Service Y ticks off. And it creates a sense of discomfort, and I think that's a very soft way of putting it. So PIR has been able to get those players back to the table. Sustaining that has been a problem. Sustaining that has been a challenge, in part because, as Paul identified, the people that start then delegate and delegate and delegate. But also, when we see a lot of good work, we're seeing the relationships built at an individual worker level. And when, as we know in our sectors, when you find and when you have really good staff, they get snapped up somewhere else. And if the progress and the change is predicated on the relationship between one worker in your organisation and an individual worker in another organisation, and either one of them leave, sustainability becomes an issue. And I think that's across the board. But relationships can be formed, and I think partnerships, the willingness to participate is there. I think for me, in terms of moving forward in this environment of change, the key thing I would look at, both at an individual service and at a systems level, are three things. And that's a willingness to give up some ground and some control of the situation. And that's going to take a bit of work, I think. There's also a willingness from service providers to say, I'm prepared to meet you halfway. So I can do X and Y, but what are you going to do? And have that reciprocal willingness. And the third thing, and it touches very much on the theme of the day in terms of the lived experience, it's a willingness for us as service providers to genuinely be guided by the needs of the people that we're here to serve.
Thanks, Bill. We've got a few things coming through. I'm noticing, Slido, there's a bit of interest in this question of collaboration. One of the things that might be worth reflecting on, Bill, is the question about what do you give up? So, you know, the issue of collaboration demands time and effort and resources. So what is it that you stop doing in order to actually make sure that you do the collaboration along the way? That's something for you to think about. Maybe, Carol, you can think about this as well. So for those of you who don't know Carol, she's the manager of, and I should know this, she's the director of statewide services. My apologies, Carol. And has had a long-standing role in helping lead the government's response to homelessness. And I'm sure you've gained a few things along the way today as well. And there are a couple of things I want to come back and specifically ask you about that are emerging from people's comments on the Slido.
Okay, thanks, Ross. Look, it's great to be here today. Probably the most I've got out of today, and by talking to Roseanne, is I think it's time to do the next part of reform. For people that know me, I'm usually the person that goes to the last page in the book because I get, sort of frustrated. But Soraya, my colleague, put a report in front of me today that was Roseanne Haggerty's report from 2005, which she wrote about ending homelessness in South Australia. So I read it again. And can I just tell you the 5 things that she said in 2005? Build a system, not just projects. I believe we built the specialist homelessness services sector. We did the reforms in 2008-9. She said, identify and house the chronic homeless. She said way back then it was actually about we needed to have data by people, we need to name people. We created H2H, and all 45 of the NGOs that are now in the homelessness sector are all joined up. We got past the confidentiality and all those other issues. Widen the range of housing options. We've done that. Do we need to do more? Absolutely. Reform the mental health system. Have we done that, Geoff?
Yeah.
Great. Okay. Tick. We've done that. And appoint a single leader with the authority to drive change. The government set up the social inclusion unit. So it's interesting on reflection for me, and I had the opportunity to talk to Roseanne last night. So we talked about, the next part, and I think it is about we shouldn't rest on our laurels. We've probably ticking along 70, 80% of right, we've got right together, because I think what I've found coming back into the space after not being in it for about 5 years, is the relationship with the NGOs. And no better did we have the example of a few weeks ago where I got about half an hour's notice to set up emergency shelter because of the weather, an extreme weather event, made 5 phone calls, and within 40 minutes we had the bus station open, we had Fred's van at the front, we had beds, we had blankets, we had a whole range of things, and I won't name all the NGOs because it was a collective effort. So to talk about collaboration, we're actually completely capable of doing it, but we need to know what the vision, what is it, what is the problem that we want to fix, and then we can all jump in and do it together. So I don't think we need to learn how to do it. We know how to do it. We need to work out what's the next wicked problem that we want to fix. And I think the rough sleeping in the inner city, I think it is growing. I went and spent the nights at the bus shelter myself and talking to homeless people at 2 o'clock in the morning. One of the things that was absolutely highlighted for me is that we work 9 to 5. And actually we need street workers at 2 o'clock in the morning. So I talked to Roseanne about that last night, and could she help us work through that? Because they actually do that in a lot of their models. So I think that's a place where we can have a conversation about, because all the people that we spoke to, it was at 1 o'clock in the morning, 2 o'clock in the morning, 3 o'clock, that's when they were coming in to chat. There are no services available and no one's doors are open and all of that. So I think, street to home and models around that, we can really sort of think about that. So, I think it's great to have Roseanne back. I think it's, giving us some levers, some energy, some passion to go back and, really let's look at the 20% that we can reform again. And collectively, I think we absolutely know how to do it. The sectors here, I think in South Australia, is fantastic. So we can do it together.
So, Carol, one of the things that we asked the audience during the break was how well the voices of consumers are heard in our organisation's services.
Yep.
How well heard are the voices of consumers in your organisation, do you think?
Up until about a year ago, really poor. We've tried different ways over many different years to have tenant groups, tenant forums, that sort of thing. I don't think we've done it really well. But what we did, and we started a couple of years ago, is we decided to we've just implemented a new service delivery model, and we decided to do an evaluation. Now, in government, what we're very good at is reviewing. And that's great because you don't really have to change anything, you just sort of, work around the edges. But we decided to do an evaluation. So a woman by the name of Senjukta Devez from DPC came over, and we actually have now, I think, we surveyed about 500 consumers. So that was people in the private rental market, people who were tenants, people who'd had our services. And I think we did, I can't remember off the top of my head, about 100 one-on-one interviews with people that are actually currently getting a service or had received a service. So we're launching a report in a few weeks. And it's probably the richest, deepest set of data and conversations that we've had with consumers for many years. So I'm looking forward to sharing that with people. So look, it's a good start because we haven't been good at it in the past.
Bill, do people in your service get heard, the people that you're serving?
We'd like to think so, in the sense that Partners in Recovery is predicated on the notion that we develop an action plan around the needs of the individual. The tension for us is the service needs at point of referral versus the individual needs. And when we're talking about people with severe and persistent mental illness and complex needs, the level of complex needs can be this big. And so referrers tend to say person X needs assistance and services around and would list 30 different things. When we meet the individual, they're only interested in one, their most pressing need at that point in time. And so we've encouraged our workers and our support facilitators to focus on that one need. Now that starts to meet the needs of that individual and starts to, we've developed the phrase, that's their hook, and that's our hook into connecting with the individual. The challenge we have then is the referrer then says, oh, what about all of this? And working at an individual's pace takes a lot longer than trying to resolve 30 things immediately. If we're talking about truly being person-centred, the flexibility of the system to then turn around and say, we as service providers need to manage our own anxiety about the fact that possibly the accommodation, the drugs and alcohol, the finances isn't being addressed right now, but we're getting the person on board. And if we can get the person on board with the need that they feel is critical, then we're far more likely to get them engaged in a conversation about other needs, but not to hit everybody with the same thing or with all of them at the same time. So from a pragmatic point of view, it is very much predicated around the needs of the individual. We don't always get it right. We constantly ask how we're going, and we get very good feedback by the individual in terms of saying, I don't want to see you anymore. That's a strong indicator for us we've missed them in the journey.
It's clear from the room, the poll of the room tends to suggest that we're not doing particularly well on this front. Alice, does that coincide with your sense of how well services do at listening to people that they're serving?
I guess it's probably best for me to comment on housing organisations and some of the homelessness service providers that we work with. I think it varies. I think the trouble is that it's not consistent rather than it doesn't happen well at all. Part of the new national regulations around community housing actually describe tenant participation and tenant engagement, which is, I think, excellent idea. And what we know from the organisations that do it well is that their tenants are very satisfied with their landlord and the services they provide, and the way that is another activity that helps people belong to their communities or their suburbs or their housing associations where they live. When it's not being done so well, people are not so happy. So I'm a firm believer in the value of tenant engagement and consumer engagement, and I think that we've always got lessons to learn and improvements to make in that area.
Geoff, one of the ambitions that was talked about was having 50% of the people in services who had lived experience. How difficult is it? Is that an achievable challenge, do you think?
Well, I've given a lot of thought because I heard it this morning. I think in our sector, in the NGO sector, when we looked at it, it's around 8% at the moment. So it's not... Look, I don't know. We'd have to work pretty hard on it, but I don't see why it wouldn't be achievable if we really put in the effort. We'd have to significantly reshape services, though, I think, to do it. I'm not convinced that's a bad thing.
One of the issues, presumably, is that you run into all the regulatory controls. You need to get people through police checks and criminal screenings and qualifications and things like that. Is that likely to be a major issue?
I'd probably need to give it more thought about what the major issues are. I'd like to think it's possible. And given we've got 8%, it's certainly possible to get to that level. So why wouldn't it be possible to go a lot further?
Paul, I'm interested in the question about who the consumers are when it comes to your service, because in a sense you've got a mixed bag, I presume. In one sense you have the broader public or the public who are being offended against, and they would be your consumers. But in all sorts of ways, when it comes to the homeless person that you're interacting with, I wonder how the police conceptualise their relationship with that person. And do they see them as a consumer of their service, or are they just someone that you're responding to?
In general sense, everyone is a consumer of our service, obviously. However, I think from the tenor of the conversation today, homeless people are obviously a significant part of our service, and that the time that we spend in the provision of that service. Now, obviously, normally those individuals can either become victims of a crime, and that's because of the vulnerable way that they live, and that is a vulnerability to them as individuals. And also, on some occasions, they become offenders of crimes. Now, we have a number of structures and processes within SAPOL to look after as best we can in relation to our Indigenous communities. We have community constables which actually look after and as best they can get to know those individuals, to get to know what their needs and their requirements are, so we can actually do the best we can in a very complex world to actually look after them so they don't become victims of crime, and also so they don't become offenders, just like any other person can within the community. So I think we have the ability to actually almost, I use this terminology again, case manage some individuals, and that's what we have to do, because you can't. Because of the complexity of this situation, you can't treat everyone the same, and you've got to look at what will work for some individuals won't work for other individuals. So that's what we have to do, and that becomes the complexity. And we all know that, especially when you start dealing with the mental health issues that we all have to deal with, that what we might decide is a poor decision on an individual's part, that individual might think it's the best decision for them. Now, we can't change that decision making because that's the way they see it. So what we need to do is be as best as we can is to support them in their decision making, and to create a free and safe environment for them to live.
There's been a lot of love in the room for one of the questions that was posed by LJD, which is that we are entering into this new phase where the NDIS is emergent, but currently homelessness services are funded on a block-funded basis, and that enables a whole lot of wraparound stuff to take place around the person themselves. How do you think, and Geoff, we might start with you, how do you think the introduction of the NDIS is going to impact on homelessness, particularly for those people that have mental health issues?
That is really, really hard question to answer because we don't have an implementation plan in South Australia. I guess what we've seen is that eligibility for NDIS for people currently on mental health programs is pretty low, like around the 20% mark. So if some of those programs are cashed out into NDIS and disappear, that means there are people who previously would have got some supports who may not get them, who could go spiralling into that homelessness space. I think there's also other issues around how much the NDIS will focus on that for people who are in the service, and you'd hope that it will be a good enough scheme that they would look at that and try to sort out that as an issue. There's also, I guess, some of the features of programs, for example, the one that Bill's running. So there are people in mental health, so people with severe mental illness, some of whom would not acknowledge they've got a mental illness, some of whom have been either voluntarily or forcibly come in contact with mental health services and didn't like what they got, and so they're actively avoiding those services. And there are some people who are kind of living quietly in the community, not necessarily doing very well, and perhaps their parents are spending an inordinate amount of time looking after them, whose parents are kind of getting pretty old, who are moving into a category of vulnerability. So I think there's a range of issues that we know are already problems and potentially could get worse under NDIS, but without doing the work of having a good transition plan and looking at how we're going to deal with those problems, it's hard to know where that's going to lead.
Carol, have you got a view?
Well, our biggest challenge at the moment with the homelessness funding, and I think the block funding gives the ability to have infrastructure around, organisations to give services to clients. But, our national partnership finishes in June next year, and our government, our minister, our premier are, leading the charge across Australia to get funding certainty. And in whatever shape or form that might come in. Because what's really hard for NGOs at the moment is they are trying to deliver services and knowing that they might not, a third of their funding could be cut at the end of by June next year, and what happens is people start looking for other employment. You get all those issues within agencies, and I think that's really tough. So, look, we're, as government have taken it really seriously, and in fact are leading, and, we've just had a national meeting and we're having another national meeting which we're leading in October to bring all the jurisdictions together to put it on the table to the Commonwealth about, the catastrophic effects of reducing the funding in the homelessness space.
Go, Geoff.
Just a further point, like when I talk to colleagues interstate, one of the things they say about NDIS is that the funding model is very, very lean. So organisations, particularly coming from a mental health space, who want to become providers under NDIS, have to make their organisations, their models, very, very lean, to the point where some have said, okay, we've got to restructure our workforce because we can't afford to pay the people at this level of qualification to do the psychosocial rehabilitation and support services we do now. To do it under NDIS, we have to employ people at a much lower level under the award or under the enterprise bargaining agreement. But the other thing that they say is that under that lean model, there is no fat. So you can't waste time building relationships that aren't economically productive. So, one person put it bluntly and said, collaboration's dead under NDIS. So if there are problems like this that arise around NDIS that are unexpected, the capacity of organisations who are delivering services is not there anymore to problem solve unless they're directly getting it in the individual service plan. So it's a real change compared to block funding, where you can, you've got a few options, a bit of wriggle room to work out how to solve a problem. Under NDIS, you just got to meet the price point.
You share those views, Bill?
In keeping with my notion of hope, I think there's...
I do notice that there's been a slight turn in the curve here. It's getting a little less optimistic.
I think this is a very good example of putting value in the NDIS and the notion of the NDIS that the individual could then purchase the services that he or she may require. So, from that point of view, the block funding shift to an individual focus doesn't necessarily equate with the person missing out on services on the proviso that the person qualifies and is eligible for the NDIS. But for me, this is a good example of not treating one part or one reform as the be-all and end-all. There will still be the state system. There is still the PHN. There are other components that equally have a right and a role and a responsibility to provide support and services to people with a mental illness. So I think for me, the hope is there that collectively these reforms and these sectors and systems that we're now developing can work together to collaboratively meet the needs, rather than simply saying Bill qualifies for the NDIS, therefore that package of support is going to meet all of his needs all of the time. I don't necessarily subscribe to that view, so I'm kind of holding out the hope that as we mature in the NDIS and the PHN and our local reforms settle down, the sector will start to look more cohesive and more integrated.
Carol, one of the things that we've talked about a lot in the sector and across the world, and I think I can't find the question at the moment. Meg might be able to find it for us. But there's this question about if we adopt a housing first model and yet our supply is shrinking, we're not exactly making housing first a big priority. What do we need to do in order to, if we're really going to embrace that housing first idea, what do we need to do about housing stock?
Oh, look, we need to make the pie bigger. You know, I mean, we have lots of debates, you know, with all of our partners, you know, NGOs, consumers, whatever, because prioritisation, we have to do it. It's very difficult. But we just need to make the pie bigger. At the end of the day, that's what needs to happen. And I think, you know, we all, you know, as governments, and that's been the conversation about the homelessness funding is, you know, we're struggling to keep what we've got, but the actual answer is we need more of it. And it's no different. I mean, we've gone from, you know, 65,000 housing trust properties to, I think the latest, you know, is at the moment we're 40,000. So, you know, the housing first is absolutely, and it's probably what my first walking around the streets of Ceduna with Roseanne in 2005, it was all about, Carol, you can take rough sleepers off the street and put them in housing. Don't ever think that you can't do that. Stuck in my mind forever, and we've been doing that ever since. And, you know, making the system allow us to do that. But, yeah, it's really hard. At the moment, we are allocating less than 2,000 people a year in public housing. And we need to make the pie bigger, and we all need to work together, government, non-government, all levels of government, and the community at large. We need to fight together to make the pie bigger.
Alice, Shelter works in this area, has done lots of lobbying across time. What do you think needs to happen in order to make the pie bigger?
Right, well, how long have we got now?
I'll give you a minute.
Oh, thanks, Ross. That might be a challenge. Look, I agree with Carol with making the pie bigger. Yep, great idea. I think it's no coincidence that we look at those numbers. We have about 25,000 less public housing homes than we had 20 years ago, and reducing. It's no mistake that our specialist homelessness services see about 22,000 clients per year, or client episodes per year. It's no mistake that there's about 20,000 people on our public housing waiting list. Affordability is a huge problem. So we've talked about some very vulnerable groups of people today, rough sleepers. We've distinguished between these rough sleepers and those rough sleepers. But I must add that affordability is a huge issue in South Australia and Australia, that it's not just homelessness we need to worry about now as a country, it's people living in housing stress, poverty, and we're seeing abuse and neglect of our children on the increase as well. All these financial pressures are adding up. So I would add to the fact that we need to increase our social housing is something that Shelter SA is looking at, is bringing social investment into the state to build new housing, medium density housing, of which some can be offered to people at below market rents. So, again, trying to keep Bill's spirit of hope, there are positive things going on in the community where, again, we're not just looking to government to solve these problems. We can look to community, business and government to work together to at least provide a roof over the heads of our most vulnerable.
Paul, how does it feel being the representative of the police in the room? You're not the only one, there are some other people with you. But when you hear this discussion about the uncertainty that might emerge around service supports for people under the vision of an NDIS, and what's your sense as the person in the police force leading the response to homelessness?
I'll be quite frank. It makes me very nervous and concerned because even today, the increase of policing dealing with mental health patients has risen a significant amount over the last 3 or 4 years. And really, I would argue, and I think most people within this room would support me in the fact that police shouldn't be dealing with mental health patients. It's a health issue. It should be dealt with at that level. It's not for the policing authority to actually deal with those people, because on a lot of occasions they actually haven't done a lot wrong. They're crying out for help, and we put them in the back of a paddy wagon. That's not appropriate. And nor is it what we should be doing as a community. So we are dealing, as we said at the introduction, at the pointy end of this problem. And unfortunately, often we've got a person that, for whatever reason, is behaving inappropriately. It might be in a house or a licensed premises or just on the street, and they are either endangering themselves or endangering others because of a mental health issue. We have to deal with them. And because we're there to protect them and to protect them from within the community, from harming the community or becoming harmed themselves. So, the perfect solution would be for them to be dealt with by a mental health person who could actually deal with their problems, as opposed to being dealt with in a policing aspect, because often that doesn't help them. But unfortunately, at 2 o'clock in the morning, there's not too many other people around that are going to provide any help other than the police. So the problem we have is that, the concerns that everyone's raising now, I will see into the future that the interaction between the police and these individuals, there's a high probability that it will further increase.
Is there any chance, Geoff, do you think, that we could build something into our system now that would actually intervene positively and enable the police not to be the first line of response in lots of these instances?
Absolutely. I think there are a lot of different circumstances, so it requires, a bit more careful consideration than just a couple of seconds here. But it's the same issue as is in the rest of the mental health system, which is basically, if we can get in front of some of these issues, then the crisis doesn't happen. And so, and sometimes, you want someone to even in a crisis, there may still be an opportunity to de-escalate if, listening to previous talks today, it's about, are we actually solving someone's problem that they think's the problem, or have we designed a service that's never going to solve it? And that's where I think sometimes the police get put in that situation where they have to come out because there's nobody else, but actually they're not really going to solve the problem well. And we could find other options. But that requires, I think that's true of the rest of our system. We do need to redesign it. Like, I think we've got some awesome services in mental health. And when I talk about NDIS, I talk about all the problems and issues, because I think some of those services will disappear to pay for NDIS. But apart from that, we've got some really good services, but we can make them a lot better if we do a bit more redesign around the things we've talked about today. So it's about meeting people's needs first, not pretending we know what they are, or not meeting a different need that they're not actually presenting with. And it's about making the accessibility right, and it's about being able to come out to crisis situations to de-escalate and avoid a worse outcome. So yeah, absolutely, we can do that.
How much will it cost?
Can I get back to you? Look, seriously, I think, I looked at the data around the WA work, and with the National Mental Health Review, they talk about, $1 billion nationally moving in terms of the balance. It's big numbers, and so it depends on the appetite for reform from funders about how quickly we can do it. But it is a lot of money, but over time, it's really not very much in the context of, You know, the biggest spend on health that we do, a lot of which is, you know, we would save some of those costs if we invested more wisely in mental health. Yeah, we can do it.
Bill, you're nodding vigorously at the end of the table.
Arguably, it costs less to provide community support than it does to provide a psychiatric bed. So if we redirect, and it's building on Geoff's point, if we redirect the supports to the person at the time when they are willing to engage, they are prepared to engage, and we are helping them along their journey, we limit the number of times that that group of people with complex needs actually require a bed. That's a simple economic argument that I think, you know, as we progress this particular journey and this particular movement forward, we keep holding back to, and that's I don't know where it's come from, but there is a fixation on beds, and I'm not qualified to inform that debate in any other way, shape, or form. But I know from my experience in this space that it's cheaper to get a support worker to go out and visit me at home and provide 2 hours of support than it does for me to be in a psychiatric ward on one day, and I could probably get 2 weeks' worth of support for that same cost. So.
Carol, you're an experienced bureaucrat. You know...
Not a very good one, some would say.
Oh, well, I'll leave that to others to judge. Why don't these arguments carry weight? Why is it that we are consistently in forums like this where we talk about if only we had this diversionary program, if only we had this mechanism for exit planning, to do that preventative work, we would actually be saving millions. What is it that's really hard inside the bureaucratic system to drive those arguments? Why is it so difficult to prosecute that argument and come out successfully? Simple question, Friday
Yeah,
afternoon.
simple question. Yeah, career ending, perhaps.
I hope not.
Oh, look, what I think's really, at the end of the day, it's, you know, a lot of, at a state level, we have to work with the Commonwealth. That's where a lot of the
So it's the Commonwealth's fault?
Yeah, no, I'm sharing it around.
Who's from the Commonwealth in the room?
I'm sharing it around, my Commonwealth colleagues in the room. But it's where the really big dollars are in a lot of these spaces.
Yes, they've got the deepest pockets.
And they have got the deepest pockets. And I think, and sometimes for states like ours, and, you know, we do a lot of work in the remote Indigenous space as well. States like ours, you know, it's per capita and, you know, we're not, you know, the Eastern Seaboard can often take some priority over some of these conversations. I mean, I think, you know, at the end of the day, I agree with that, but there's always, in the system, where is the bulge going to be? And I think we do debate it, and sadly for us that have been around long enough, you know, we change our minds about where the bulge should be. We go to the early intervention and then we go to the crisis point. So, you know, we change our mind about where the bulge is. And I think at the end of the day, it is about making that pie bigger. And I don't want to sort of simplify by saying that, but, you know, one of my learned colleagues in the room once said to me, there's only ever 5 good ideas. And I think they're right. You know, we sort of churn and we pick different things. But, you know, a lot of it is about just funding and funding priorities. And you can talk about education, you can talk about health. None of us would debate that they're not as important as homelessness. So where do we, you know, there is only a certain dollar. I think what we've got to make the most of is the partnerships with government and non-government and actually enhance and add value to each other. Where I think we get into trouble is where we actually try to defend our patch, and then I think clients get lost in that. So, to be honest, I think when we come to the table and say, what are we going to do about, and I think it's what Roseanne talks about, you know, whether it's a community or, you know, an NGO and myself or whatever, if we are coming to the table with a shared problem and saying, what are we going to do to solve this together, that's where we will make a difference. But when we go to our patches or whatever, you know, I think that's where we you know, where we have those problems, and we've got to keep solving it together. And like I said, you know, I've had an experience in the last few weeks with a winter response where, you know, we absolutely came together. So we can do it, and there's many, many more examples, you know, of that. So yeah, I think that's. Is that career ending? No.
Well, here's another one just to, you know, keep you in
God,
the mud if you like.
God. Okay, here's another chance to.
Have you ever seen a jurisdiction, and this is Slido's question, have you ever seen a jurisdiction where you actually think that there's been enough money spent on homelessness? And there's a question for all of you, so you can start, Carol. Have you ever seen one? You think, yep, they're spending exactly the right amount?
No. But look, to give us a, you know, and I'd be interesting to hear Roseanne's view about this, but we have led the way nationally. You know, the NGO sector and government have done amazing with our reforms since 2008-9. We have made a significant, you know, we have gone forward in this space. Should we rest on our laurels? Absolutely not. You know, we are ready, and like I said, the 80-20 rule, 80% is probably about right. We should now look at reforming and going to the next steps, and that's what I was talking with Roseanne about last night, and I know she's met with the Premier this week and the ministers. So, you know, we go to other states all the time. We don't, you know, there's some fantastic things, but, you know, we often lead the way in this state on these issues. So, and look, you should always look, you know, internationally and nationally, you should always open your eyes up to that. But, you know, I think, you know, we'd have a reasonable report card, but I think we're ready to absolutely go the next step now and add value to what we're doing.
Paul, have you ever seen a jurisdiction where you felt like homelessness was being properly addressed? There was enough resources going to the place?
No.
Geoff?
I was going to ask Paul how many he's seen. Not in Australia, no. And it's that issue.
Have you seen one somewhere else?
Not personally, but I've seen read about an interesting place in the north of Italy, Trieste, where in terms of their investment in mental health, they spend something like 7% on inpatient units, whereas in Australia, correct me if I'm wrong, but it's more like 50%. On the bed-based components. And so there's certainly some innovation that happens, but in Australia, the key thing is that we're not spending enough in mental health. None of the jurisdictions are, compared to the burden, and where we've come from traditionally is we started to spend our money in the high-cost area, and we've most underspent in the low-cost area that really makes the other part efficient. Like, so there's no better example than the intensive home-based support service, which was independently evaluated. It was operating in South Australia. Unfortunately, was funded through Commonwealth state money and has ceased. But the evaluator said that it would have paid for itself in terms of reduced costs of hospitalisation for the people it supports. You know, like, I've studied a little bit of economics, but I'm no economist. If I was looking, you know, if you had the opportunity across, you know, budgets for government departments, and you had the opportunity to say, well, which one am I going to spend my money on? I can't imagine you wouldn't pick that. But unfortunately, through the political processes we've had, it's been defunded.
Alice, have you ever seen a jurisdiction where you thought, yep, they've got the balance right?
Short answer's no, but I don't think how much we spend is the issue here. And it's pointless to say there's only so much money and it doesn't go any further, because in the latest state budget, I mean, there was $56 million to provide 198 new prison beds in South Australia. Now, we know we've got a fairly small number of children, for example, who are kept in youth detention centres at a cost of nearly $800 a day, when community correction services cost less than $80 a day. So we're putting resources into these children after they enter detention. You know, we know well who these families are. they're homeless, they're living in poverty, their parents have got mental health and drug and alcohol abuse issues. There's child protection issues across all government systems. We know who they are. We wait until they get into such a terrible situation that we start spending money on them. So my answer is I think we probably spend enough, but we have no plan to stop working at the crisis end of this system. We're always trying to do more than what we've got. Homelessness numbers are going up, people with mental health issues are going up. Until we have, I think, a bipartisan plan and a long-term plan to turn this issue, this situation around, we're just going to see more and more and more money needed. So if we look at some of the European countries that do work together on these issues over 30-year periods, take politics out of the equation, we can have enough money.
Okay, home stretch. I hear there's drinks in a little while. In a minute or less, when you think about the way ahead for South Australia, what are the one or two things that come to mind? And I'd welcome all of you using Slido to take the opportunity to also, as you've sat here, you've thought about this stuff, you've heard people's commentary. What for you has resonated that says to you, if only we did this, what would it be? So feel free to contribute from your perspective. Now that you've all had 10 seconds to gather your thoughts, we'll start at that end and we'll come to this one.
Oh.
Go, Carol.
Okay, I think we should reform assertive engagement street work and do it 24/7 or at least at night.
I think we need to direct our services and our engagement with people at the early end of their journey when they're far more likely to be open to working with other services.
I think stronger collaboration between all the different agencies and the provision of services at the time when our homeless need them.
So for people at the severe end, it's really reshaping our services so that we're delivering what people need at the time that they need them, and we don't just do a short intervention to help them to improve a little bit. We make sure that they're actually on the path to sorting out their severe problems and getting on with building a good life in the community, and making sure that we're focused on that in our strategy, and we're collecting data all the time to make sure that our investments are actually delivering results, and we keep tweaking them to make sure we do that, and not just half help people or help them with one problem they didn't really want help with. It's really important to re-engage on that.
Thanks, Geoff. Alice?
I think what South Australia needs is some big thinking. It's all very well while we dabble around the edges of all these issues and everyone's got their own little patch. Even though we've worked well together today, I don't think we need to be looking at changing the time zone in South Australia, or driverless cars. As much as I think they're kind of cute, I think we need big thinking that brings employment and resources and affordable housing into this state is what's going to be the thing that will help people living on low incomes, help people living in poverty, and free up some of this crisis system to help the people that are really in need.
So at this juncture, I'd like you to join your hands together, stamp your feet and say thank you to our panel.